All content in this video, including but not limited to text, graphics, images, audio, and video, is the property of Toward Health and is protected by international copyright laws. Unauthorized distribution, reproduction, modification, or use of this content without prior written permission from Toward Health is strictly prohibited. For permissions, please contact us at contact@drtro.com.
Good day, everybody. Thank you so much for joining me for this important topic. We are going to be talking about how important sleep is for optimal health. First, I was really surprised when I saw these slides from Dr. Tro and had to include them. So on the left side there, you can see that short sleep duration is really prevalent all over the country. However, it's really concentrated more in the Southeast. And if you look at the frequency of mental health conditions, it is also prevalent more so in those areas. When we start looking at other problems across our country, you start seeing the same things. The rates of obesity are also growing everywhere, but more concentrated again on that Southeast portion. And now we can see, as the 2000s continue to progress, we are having more and more states with rates of obesity more than 30%, and it is just a growing problem. We then start looking at other problems. Same exact trends are showing up. Arthritis, extremely common now, and we all know there's a huge diabetes, really another pandemic, but epidemic going on as well. We look at, besides diabetes, we also see heart disease and cancer deaths tracking in these same areas where we are also seeing short sleep durations. Not saying that short sleep durations are the only cause, but there is one of the pieces of the puzzle that we should not be neglecting. 1/3 of your life is spent sleeping. Think about that for a second. Do not underestimate the importance and power of something we are meant to do for 1/3 of our lives. Really think about how many times has someone told you, hey, you should really be prioritizing sleep more than many other things, more than a medication you might have been told to take. It's probably not actually all that common. But it makes sense that we train to study our favorite hobbies, or we had to study hard for our work, our jobs, to become excellent at what we do. And I think it's important that now we say, let's become sleep experts. You will spend more time on sleep than any other single activity. And with that, we're going to jump in to talk about what is sleep, sleep's role in health, how to practically improve your sleep, and then go through some frequently asked questions surrounding sleep. First, there are two basic types of sleep. And broadly speaking, sleep keeps you alive. Humans cannot function without it. It's an extremely complex process that progresses through multiple stages, each of which have very specific functions in our body. And hopefully, as we better understand these functions, we'll be motivated and get empowered to actually get better sleep. And the two basic types you've probably heard of are REM, or rapid eye movement, and non-REM, which goes through 3 stages. Memory consolidation, memory formation really requires both non-REM and REM sleep. Non-REM sleep goes through 3 stages. The first stage, only about 5% of the night, is going from wakefulness to sleep. Your eye movements start slowing down, your muscles relax. Sometimes you have an occasional twitching motion you might have felt going to sleep. Stage 2 is where we spend the bulk of our time. This is a light sleep. Our muscles are continuing to relax, our body temperature is dropping, and our eye movements stop. Stage 3 accounts for about 20 to 25% of your sleep. It's the deep sleep, helps you feel very refreshed in the morning, and occurs for longer periods during the first half of the night. If you wake up during this stage, you might have something called sleep inertia or brain fog for the next 30 minutes, sometimes a little bit longer. Interestingly, our bodies produce the most human growth hormone during this stage. REM sleep also accounts for about 20 to 25%, and these numbers will change a little bit depending on the age. This typically occurs about 90 minutes after you go to bed. Your eyes are going to be moving rapidly from side to side. This is where most of our dreams occur. Your arms and legs actually become temporarily paralyzed, so you cannot act out your dreams. And The initial cycle might only be 10 minutes, but then increase up to an hour as you get closer to the morning hours. When you progress through all stages of sleep, that is one sleep cycle. Typically goes from stage 1 to 2 to 3, back to 2 to REM, and then back to stage 1 or 2. However, you actually can cycle between stage 2 and 3 a few times before going into REM sleep. Generally, people get 4 to 6 sleep cycles per night. These on average last 90 minutes, but some people will have shorter sleep cycles, and some can have sleep cycles up to 2 hours. And if you go to bed, say in the early hours of the morning, around 1 a.m., you might actually not get adequate deep sleep, as the body is designed to get deeper sleep in that earlier aspect of the night. These were some really surprising sleep statistics I just wanted to cover. 35% of adults suffer from sleep restriction, which is less than 7 hours per night. Looking at the map at the very beginning of the presentation, we could see that. 50% of adults report feeling sleepy during the day, from 3 to 7 times per week. The annual cost of workplace errors and accidents linked to insomnia is over $30 billion per year. On average, people lose 11 days of work if they have insomnia per year. 10 to 30% of people have chronic insomnia. Drowsy driving is responsible for 6,000 fatal car crashes every year. 4% of people have fallen asleep by the wheel driving in the past month. So that's just 1 out of 25 people in the past month. And then 57% of teenagers who have technology in their bedrooms will have sleep difficulties. So parents, that's a call to you. Get electronics out of the bedroom. It's going to be impacting your teen sleep, which we just saw is linked, and we'll cover a lot more in depth, how important sleep is through a multitude of things for our health. And actually, let's dive into that now. You've probably heard about all these things that sleep does for you, but I do want to give you an example on the next slide of the physiology and how complex it is and important it is. So I'm going to highlight how the brain actually cleans and repairs itself next. But basically, when you're sleeping, your body is resting, it's repairing and cleaning itself, forming memories, organizing information, and processing new information. You've probably had the experience where you were going to bed thinking about a problem and you woke up in the morning and you solved it. It refills your emotional battery, enhances your clarity of thought, and so much more. There's something really cool called the glymphatic system, and this is where your brain replenishes and cleans itself. It removes the harmful metabolic waste products that accumulate during the day, and the vast majority of this occurs during sleep. It clears tau proteins and amyloid beta plaques that are associated with dementia, and there's an almost 90% increase in the glymphatic system during stage 3 sleep relative to being awake. Interestingly, intermittent fasting, omega-3 supplementation, and ketones have been shown to increase glymphatic clearance. We won't have time to look at all of these things, but we know that inadequate sleep is linked to obesity, type 2 diabetes, impairing our immune system, mood disorders, cardiovascular disease, arrhythmias, hypertension, dementia. In adults who sleep less than 7 hours, studies show up to an 80% increased risk for dementia. Impairments in memory, cancer, quality of life, kidney disease, chronic pain, stroke, alcohol use, and mortality. So the list just goes on and on. In regards to metabolic health, sleeping less than 6 hours per day is associated with an almost 40% increase in the incidence of obesity and risk for type 2 diabetes, hypertension, and cardiovascular disease. The increased risk of obesity and diabetes occurs through multiple mechanisms. We'll go over a little bit more in depth on the next slides, but we see an increase in energy intake by several hundred calories per day, and that people will eat more frequent, smaller, energy-dense, highly palatable snacks at nighttime if they're sleep deprived. And this is really occurring through complex hormonal reactions, but there's been studies showing that your hunger hormone, ghrelin, which is a very powerful hormone, no amount of willpower will outcompete ghrelin, actually goes up when you're sleep deprived. So it makes perfect sense that you are going to eat more when your ghrelin levels are higher, and that will happen with sleep deprivation. Whereas leptin, your hormone that says, hey, you're you don't need to keep on eating. Those levels actually drop with sleep deprivation. In this study, they had 12 individuals who completed 14 days of 4 hours of sleep, so a lot of sleep deprivation, and then 14 days of 9 hours of sleep. And they had a long washout period between the two 14-day time periods. They found in the individuals that they sleep deprived, they ate on average over 300 more calories per day. And although they did gain weight, more importantly, they had a 10% increase in their visceral fat. And this is the fat around the organs that we really worry more about. There are other studies that have shown those who have on average lower sleep duration, so that's what this graph here is looking at, lower sleep duration, is associated with having a higher BMI. And those with more sleep variability also having a higher BMI. Sleep variability being you're going to bed and waking up at different times throughout the week. So we know sleep deprivation, not great. What happens if we extend that sleep period in people? And so they actually did that. They did a randomized trial where they took 80 adults who slept less than 6.5 hours, and then they randomized them and said, hey, try to sleep 8.5 hours. They found that this group of adults that they extended their sleep consumed over 270 less calories than the control group. And for each hour increase, they on average ate 160 less calories the next day. They also had improvements in their mood and their alertness, not surprisingly. Sleep deprivation is highly related as well to our cardiovascular health. It can cause increase in our sympathetic nervous system, so that's our fight or flight response, which increases blood pressure, impairs our endothelial function, that's our blood vessels, what lines all of our blood vessels, and that creates damage and cell injury, which we know is associated then with hypertension, irregular heart rhythms, again, heart attacks themselves, and metabolic disease. We won't have time to go over sleep apnea today, but that's also a really relevant and important topic. And we will soon be having a section in the app where you can learn more about sleep apnea in the sleep course. I now want to briefly cover just a couple of other areas where we see a big impact with sleep deprivation in addition to cardiovascular health. In terms of our immune system, there's a 3 times higher risk for the common cold with less than 7 hours of sleep, 5 times higher risk if your sleep efficiency is less than 92%, which means the percent of time you're actually asleep while in bed. There's an association with increased inflammatory and autoimmune markers, and a 50% decrease immune response to the flu vaccine. Both insomnia and circadian rhythm disturbance is associated with increased risk of several different kinds of cancer. And in relation to mental health, only 1 week of sleep deprivation by 50% caused self-reported optimism to drop by 10%. We know that insomnia has a 2.5 times higher risk for all psychiatric disorders, and chronic sleep problems affect 50 to 80% of patients with psychiatric conditions compared to less than 20% of the general population. There's also other studies in regards to mental health showing that improvement in sleep leads to improvement in depression, anxiety, ruminating thoughts, psychosis symptoms, and improvements in quality of life. We just talked about the amount of sleep, but the timing of sleep also matters too. And that's talking about the circadian rhythm. When our circadian is misaligned, that means we are awake or eating food when the internal circadian system is trying to promote sleep. And we've shown in studies that eating within 2 hours before bed is linked to later bedtimes, trouble falling and staying asleep, and higher risk for obesity. It also decreases 24-hour energy expenditure by about 3%, alters our appetite hormones, and promotes unhealthier food choices. In residency, you have to do a lot of shift work. You work night shift, a 24-hour shift, and you can easily tell the difference in the ability to eat healthy versus not, and it's really being hormonally driven. You don't have the bandwidth to not eat some of those foods. Also wearing a continuous glucose monitor, you can eat the exact same thing and you actually see a much more of an increase in your blood sugar even when it's the same foods, just because it's at way late in the night or early morning hours compared to eating that would align with our circadian system. There's a cool study that looked how does eating close to bed affect your sleep, and compared to early eating at 3:30 in the afternoon versus late eating at 7:30, the late eating caused double the odds of being hungry, an increased ghrelin to leptin ratio. So again, there's that hunger hormone increasing and the leptin level decreasing, decreased the body's energy expenditure, decreased the expression of fat breaking down genes, and increased the expression of fat building genes. So this goes way beyond willpower. You're actually talking about genes being turned on to make us gain weight if we're eating closer to bed versus genes that would help us break down fat being turned off if we eat close to bed. Also, we've seen that there's a slight increased risk of heart attacks and stroke following daylight saving time, again showing relevance and importance of sleep. Now that we've talked about how impactful sleep can be in our health, let's talk about how can I practically improve my sleep if I'm not sleeping great. First and foremost, and I'm going to sound like a broken record here, is sleep hygiene. Go to bed and wake up at the same time every day if you can, even on the weekends, and you want to try within a 30-minute window. Avoid caffeine and nicotine later in the day, after lunch if possible. I've even had people who say their morning cup of coffee, when they have taken that out of their life, their sleep is better. Avoid alcohol several hours before bed. Alcohol can prevent your body from getting REM sleep, and this can be a really difficult cycle because oftentimes people will drink alcohol to help with anxiety or emotions, but if you don't get that REM sleep, you don't refill your emotional battery, and so there's this vicious cycle that can occur. Again, avoid eating several hours before bed. We just talked about several reasons why that's important. If you can, and it's hard because we're really busy, but creating a nighttime routine and being able to get your body relaxed for about an hour before bed to wind down can be helpful. And then you want to create a room for sleep or intimacy only. Keep temperatures low in the room, avoid bright light or electronics, loud noise, eating. In that picture there, you can see those are kind of red lights. And so that's something else can be helpful. Again, trying to avoid the bright lights, that's going to prevent our melatonin from being released. If you do live in a bright area or there's noise in your area, then eye mask or earplugs can be really helpful if needed. If you wake up in the middle of the night to pee a lot, sometimes that can be as simple as just drinking fluids earlier in the day and restricting in the evenings. If that doesn't seem to be the issue, that can actually be a sign of sleep apnea. You might want to check into that. You want to avoid relying on sleep medications, even over-the-counter ones, and we'll talk about that a little bit later. You want to avoid napping during the day if you struggle to sleep well at night. Don't look at the clock. That can sometimes create this anxious feeling and you just continue to stare at the clock as it progresses overnight. And then you want to go to bed when sleepy. Some additional sleep tips. Try to get natural daylight early in the morning. If it's dark when you wake up and you go to work and you can't, you can actually buy a bright light lamp. It's typically 10,000 lux that has been shown to be helpful. And when you first start enjoying your cup of coffee in the morning or water, whatever it is, have that bright light lamp giving you 30 minutes of sunlight before heading to work. Wear socks to bed. This, for some people, can make a really big difference, helping regulate your body temperature. Weighted blankets can be helpful, cooling mattress toppers, keeping pets out of the bedroom. Even sometimes considering separate beds if you and your partner wake each other up frequently. Using a light bulb sunrise timer instead of an alarm clock. So alarm clocks can sometimes be really jarring and trigger some anxiety or waking up with a big rush of adrenaline in the morning. Whereas a light bulb sunrise timer, again on the last slide you saw, that can be a very pleasant way to wake up. And then some people find white noise very helpful, and the HEPA filter not only will filter your air, but also provides white noise at the same time. A few other sleep tips. If It's right time in your journey. Be physically active for at least 20 minutes per day, and ideally separated a few hours before bed. Keeping a gratitude journal before bed and first thing in the morning can also help. And then keep a notepad next to your bed. If your thoughts are racing, just write them down, and then write down maybe one or two other things of how you're going to deal with that tomorrow, so that your brain can feel like it really is safe. You're not going to forget. It will get done. Now, maybe you do need to do a circadian reset. Our circadian rhythm is heavily impacted by light. First thing you want to do, get light exposure upon waking up and avoid bright lights before bed. Kind of similar idea, potentially getting the red lights in the house, using blue light blocking glasses, not getting your face too close to monitors or screens, changing your phone background to a darker background, dim lights in the house, keeping a regular sleep schedule, daily physical activity early on in the day if possible, avoiding caffeine, alcohol, and nicotine especially. And then shift your bedtime slowly. If you're going to bed at 1 a.m., you just move it back to 12:30 a.m. for 1 week, and then keep doing that 30 minutes at a time. You don't want to try to shift from going to bed at 1 a.m. to all of a sudden going to bed at 9 p.m. every night. That would be difficult. All right, I'm going to transition now to insomnia. And there's been a lot of research with insomnia because it's a really prevalent issue. The studies that show long-term benefit show that cognitive behavioral therapy for insomnia beats all medications. And there's several ways to go about this. There's therapists. You can do in-person or teletherapy. There are books actually that will guide you through programs. So Say Goodnight to Insomnia, 6-week program by Greg Jacobs is one that people have found really helpful. There are apps that will walk you through it. CBTI Coach, Insomnia Coach is another one. And at the very end of this PowerPoint, I put a link to UMass's CBTI 5-session program. It will have some things that you can't actually work through because it'll say work through this thing that the doctor gives you, but because you just have the educational information, you don't have the handouts, you can just read through it for the good information. There are apps like Better Sleep, Headspace, and Calm help with meditation, winding down, anxiety. And then there is a time and a place for medications. Usually it's only short-term treatments if there's an acute life stressor potentially that's contributing. You really do want to avoid long-term due to dependence, tolerance, and side effects, which we'll dive into in just a bit here. And we'll also talk about a couple supplements that can be helpful. CBTI for insomnia has a lot of different pieces of it. One of them is trying to set realistic expectations around sleep. Studies show that poor sleepers underestimate how much sleep they get. So you want to tell yourself you're getting more sleep and at least rest than you think. And you want to restructure negative sleep thoughts. For example, I will not be able to function tomorrow. I must get my 8 hours. You change that thought to, I've actually functioned quite well after a poor night's sleep. 7 hours is wonderful. And anyone who has children knows you can function really well actually with some sleep deprivation. Another technique that is sometimes used is sleep restriction. You want to find out how much you sleep on average. For example, if you only sleep 6 hours, then you want to allow yourself to only be in bed for 6 hours. No daytime naps. And you want to wake up at the same time for 7 days and build up your body's sleep drive. Stimulus control is the idea of, again, bedroom for sleep and intimacy only. And if you do not fall asleep within 20 to 30 minutes, go to another room and engage in a quiet activity. Read a book, listen to relaxing music until you feel drowsy for about 30 minutes, and then try to go back into the bed. Relaxation can be really helpful. Progressive muscle relaxation is a technique where you start at your toes and you tense and relax all your muscles throughout your body, working your way up. Diaphragmatic breathing is another one. You breathe in for 4, hold for 7, and breathe out for 8. Helps slow down your heart rate and get you back to sleep. And then again, some meditation or guided imagery, which you can use apps to help with. When it comes to supplements, generally you don't want to rely on supplements for sleep, but there are some that can help. Melatonin may improve sleep quality, it can help with jet lag. Overall, the effects seem to be fairly small. And it's actually typically a smaller dose of melatonin than some of the common over-the-counter supplements that you'll see. But just starting with half a milligram 30 minutes to an hour before bed, you try to avoid higher doses, more than 5 milligrams, and increase that as needed by about half a milligram per week. Be aware that melatonin can cause some vivid dreams or nightmares. And there's also a huge variation in quality and amounts in over-the-counter supplements, sometimes 10 times higher than they say. So this is something you'd probably want to work with a healthcare practitioner or make sure in some way that you are getting a verified supplement. Again, it could help with jet lag, shift work, and maybe even adjusting sleep schedule. If you take higher doses, that can actually shift your sleep schedule as well. Selexin or lavender oil has also been shown to be beneficial, taken at about 45 minutes before bed. And this can be helpful more commonly if there's anxiety or intrusive thoughts that are contributing to your insomnia. And adverse events are pretty rarely associated with that. A few other supplements that have a little bit less research behind them are ashwagandha. And there's some positive data. There are some more medication interactions with ashwagandha. You want to avoid it while pregnant or breastfeeding. Regarding valerian, L-theanine, tryptophan, and glycine, the evidence is mixed. They're very low risk for harm. So if you have started one of these and you really are finding good impact and treatment for your insomnia, then it's likely safe to continue. In regards to CBD, there's only a few products that are FDA approved. It may help reduce pain, which is a big trigger for insomnia, anxiety, and it does have some interactions with medications as well, so just something else to work with your doctor. Electrolytes in sleep is something that can be underappreciated. Oftentimes, this is actually triggering insomnia or sleep difficulties. Although the evidence is mixed with magnesium, there is some that it may improve sleep quality, and anecdotally, some people really benefit while others do not. And given that about 50% of people do not get enough magnesium from their diet, I think it's always worth trying if sleep issues are at play here. It's typically about 500 milligrams per day. You also want to make sure you're getting enough sodium, potassium, and calcium, as too little sodium levels can actually increase adrenaline levels, impacting sleep. And oftentimes people are worried, if I increase my sodium, my blood pressure is going to go up. The vast majority of people do not have an increase in their blood pressure by adding in sodium or other electrolytes. It's really the sugar that is going to be driving insulin, which is going to be driving blood pressure. So especially if you're eating low carb, more electrolytes are typically what you need. And we actually have an app that goes in a lot more depth, or an article in the app that goes in a lot more depth on electrolytes and keto. If you go into the courses, the weight loss course, medical considerations before starting, and then electrolytes and keto. So don't have a ton of time to go into this, but it was interesting. So we're going to talk just a little bit about sleep trackers. They looked at 3,900 hours of sleep sessions based on 11 different consumer sleep trackers and 500 hours of polysomnography, which is the gold standard of looking at the stages of sleep people are in. And you can see pictures of the wearables here in the middle, and then the nearables, which are things like Withings, sleep tracking, or Google Nest Hub, which are like they are near the body. And then the wearables, which are mobile apps on your phones. And we won't look at this too in depth, but the diagonal blue is good. It's the y-axis is the true label, whereas the x-axis on the bottom is the predicted label from the sleep tracker. So you can look at all of these different ones, and what you would want ideally is for 100% of it, the data to line up. So if you're truly awake, you want the device to tell you you're awake. So that would be 100%. You can see with the Google Pixel Watch, only 22% of the time did the device say the person was awake when the polysomnography, the gold standard, said they were awake. The takeaways from that kind of complicated looking slide: most wearables overestimate sleep by misclassifying the wake stages. Oura Ring's the best at not doing this. Wearables are good at monitoring deep sleep stages. Nearables are not good at monitoring deep sleep. Of the Arables, sleep routine was the most accurate at predicting wake and REM, and most sleep trackers are better at predicting REM sleep than deep sleep. I think they can be very helpful to see kind of quality of sleep and get a general idea of your sleep stages, but they are not accurate enough to truly say, oh, I was in REM sleep and I got 30% REM but only 10% deep. I'm low in my deep. How can I increase it? They're just not that accurate. But you can see other data from them. Say you have a big meal before bed, you will absolutely see a decrease in your sleep quality using your wearable, and that can be helpful. We're going to finish up with some frequently asked questions. Why do I wake up after 2 hours of sleep? First and foremost, sleep hygiene. This is where I said I'm going to sound like a broken record. If there's light or noise in the bedroom, think about getting blackout curtains or earplugs. Caffeine too late in the day can absolutely trigger you to wake up after you've fallen asleep easily, so you might not think the caffeine is impacting you, but then you're waking up later in the evening. Alcohol will definitely do this. Large meals too close to bedtime, stress, and then sleep disorders like sleep apnea. Again, going back to the sleep hygiene, don't drink too much liquid before bed if that is causing you to wake up and have to use the restroom in the middle of the night. How can I get back to bed after waking up in the middle of the night? Think about optimizing sleep hygiene. Don't look at the clock. Don't look at your phone. Don't go to the bathroom if you don't need to. I've had some people tell me when they wake up, which a lot of people will actually wake up after a sleep cycle. That is very normal. You just go right back to bed. If you do wake up and you don't have to use the restroom, don't do it. You might get into a deep enough stage of sleep where you continue to not have to use the restroom. 4-7-8 breathing, that can be something, again, helps slows down the heart rate, calm the body, and go back to sleep. Make sure you don't have sleep apnea. Sleep apnea is way underdiagnosed. And listen to relaxing music. Some people have found a ton of help from listening to a non-exciting book, emphasis on non-exciting. If it's too exciting, the brain's just going to start being engaged, and it's going to make it harder to fall back to sleep. Again, not only is it normal to wake up after a sleep cycle, but it's common to wake up in the middle of the night around 2 to 3 a.m. as your body temperature is rising. Don't worry about that. Go back to sleep. Is it okay to take NyQuil or over-the-counter medicines every night for sleep? It is not ideal. Many of these actually impact our natural sleep architecture. You get less deep and REM sleep. Common ones that people will take are NyQuil, Unisom, sleep, or Benadryl. There are a lot of side effects: constipation, dry mouth, balance issues, impaired daytime performance, short-term memory loss, blurry vision, increased heart rate, difficulty urinating. And these medicines, although they can help fall asleep, they're also called anticholinergic. Acetylcholine is an important molecule for short-term memory and thinking. And in those over the age of 65, taking many anticholinergic medications is actually associated with confusion, falls, dementia, and even death. Is it okay to take prescription sleep medications every night? Again, it's not ideal. Many impact our natural sleep architecture, causing less deep and REM sleep, which are extremely important for the reasons we spoke about earlier. A lot of the time, these medications lose their effectiveness over time while making your body dependent on them. There are side effects, some of what were on the last slide, but impaired alertness, coordination, and memory. The common ones you might have heard of are Ambien or Zolpidem, temazepam or Restoril, azopiclone or Lunesta. These are also associated with an increased risk of dementia and death, and also sleepwalking. And I've actually had people tell me they drove a car while taking one of these medications and sleepwalking while driving, and also sent emails, work emails, while they were asleep. Doxepin is another medication that is also associated with an increased risk for dementia. And then trazodone may be your best option if you are going to be on something longer term, as it does preserve REM sleep. How can I increase my deeper REM sleep? First and foremost, practice good sleep hygiene. In regards to REM sleep, avoiding alcohol several hours before bed. Certain antidepressant and antipsychotic medications may reduce or almost entirely suppress REM sleep. And there's something called REM rebound when people stop taking them, where the body will actually jump immediately or very quickly into REM sleep because it has been deprived while on those medicines. And stopping over-the-counter sleep aids, again, because some of those also impact the ability to get REM sleep and deep sleep. With deep sleep specifically, sometimes taking a warm bath or shower before bed can be helpful. Heating your body about an hour before bed may help draw the heat to your hands and feet, which then dissipates. And so that process allows you to cool down to a comfortable temperature and get into some deeper stages of sleep. Last question, could my heart or blood pressure medications impact my sleep? And there are a lot actually that could. So ACE inhibitors, example being lisinopril, can worsen what we call the AHI, or the apnea-hypopnea index, in individuals with sleep apnea. And that's because for some people it can actually worsen the nasal inflammation. Metoprolol and propranolol can increase nighttime awakenings and total awake time during the night. For some people, they can increase daytime fatigue, insomnia, nightmares, and even cause hallucinations. And they may suppress REM sleep as well. These side effects, sorry about that, can't go back, but those side effects do not occur for everybody, but it's just something to consider. The other medications that we just blew through really quickly are antiarrhythmic medications, and there is a lot of those, such as amiodarone. And again, they do have a potential impact, so that's just something to consider. Could you switch to a medication that might not have a negative impact on your sleep? Here are the links to the UMass program on overcoming insomnia. And so again, you will see the sleep course referencing some documents you won't have access to, but the information can be very helpful, and you can use it as a guide and work with your doctor to help treat your insomnia. And with that, I thank you so much for spending some time with me this morning, and we'll leave it open for questions.